Hi, everyone. My name is Aishwarya Arjunan, and I am a genetic counselor here to speak with you about referrals to genetics. What are we going to cover today? First off, what is a referral? Who needs one? Why would someone need a referral? Who are these genetic professionals that you might get referred to? What happens after you get a referral? And what are additional resources that are available to you? So let's start with the first question. What is a referral? A referral is a request from one health professional to another health professional or health service, asking them to evaluate you for a specific reason. For example, if you get a referral to ophthalmology, that means you're being sent to the eye doctor. So maybe your primary care provider noticed something during your eye checkup and thought that they needed some additional opinions or additional advice. So they made a referral to you to go see an ophthalmologist so that you can get that additional evaluation. So if you get a referral to genetics, that means you're being sent to a genetic healthcare professional, such as a medical geneticist or a genetic counselor. Who needs a referral? Generally, anyone that wants to or needs to see a specialist other than their primary care physician or a pediatrician will need a referral. For many insurance plans, a referral is usually necessary in order to see that practitioner or specialist outside of your primary care provider, especially if you want that to be a covered service. There are some cases in which you can visit a specialist without a referral as well, but if you want to use your insurance, it's always worth double checking to make sure what you need in order for it to be covered. Why might you need a referral to genetics specifically? Sometimes a referral to genetics could be initiated by your provider. So it could be that you or your child's doctor may suspect a genetic condition, but wants to refer your family to a geneticist for further testing to rule in or out the condition. A referral could also be family or parent initiated. When a parent or guardian suspects something may be genetic, they could ask their doctor for a referral to a geneticist. Either way, most geneticists ask that there is some type of provider referral before their clinic will schedule an appointment with you. If you aren't sure exactly what the referral process is for a genetics clinic, it's really best to call or look on their website to see what their process is, because it could be different from clinic to clinic. But if you or a family member is concerned about a genetic condition, either in yourself or in a child, it's definitely worthwhile to seek out a referral to genetics and speak with a genetics professional. So you might be wondering, who are these genetic professionals that I'm referring to? There are different genetic professionals that you could meet with during an appointment, depending on your reason for visit. You could meet with a clinical geneticist who is a medical doctor specializing in genetics, or you could meet with a genetic counselor who is a master's level trained healthcare professional in genetics and counseling. Genetic counselors are really there to guide and support patients and families that are seeking more information about how certain inherited diseases and conditions might either affect them or their families and children, and to help interpret genetic test results based on your personal and family history. But both of these professionals work with individuals, families, communities, and healthcare professionals to really empower everyone to understand how genetic information can impact your lives and the lives of your families. So what happens after a referral happens? Once a referral is made, you then need to set up that appointment with the geneticist or genetic counselor, or if a referral was made to a different specialty, then now you're able to call that clinic and set up that next appointment for your additional evaluation. Now we're going to watch a short video from the National Society of Genetic Counselors explaining the role of a genetic counselor, what happens during that referral process, and what happens after a referral as well, and how this can help you and your family.
Have you seen the term genetic counseling in the news lately? Or maybe your physician has referred you to a genetic counselor and you're not sure what's next? You may have questions about genetic counselors. What do genetic counselors do? When should I see a genetic counselor? What happens during an appointment with a genetic counselor? Genetic counselors have specialized education in both medical genetics and counseling. This prepares them to give you the personalized help you need when it comes to your genetic health. Today, there are thousands of genetic tests, and the number of tests available grows each year. How do you know whether a genetic test is right for you and what the results mean? Using their genetics expertise, a genetic counselor can work with you and your physician to understand your genetic risks, the tests that may be right for you, and what genetic test results may mean for you or your family. With their expertise in counseling, a genetic counselor can also provide emotional support as you make decisions and empower you with information for your overall health care. Genetic counselors can partner with you, your primary physician or specialist, and your entire healthcare team to integrate your genetic information into your overall healthcare or medical treatments. Genetic counselors work in a wide variety of medical specialties. Genetic counselors help and support patients for a variety of reasons or situations. Maria and Tim's son was diagnosed with autism. They want to know if there is a hereditary link in their families and whether any additional children may be at risk of developing autism too. Susan's mother and aunt were both diagnosed with breast cancer at a young age. Her doctor has recommended genetic testing to determine her risk for inherited breast and ovarian cancer. Linda and Joe want to start a family and they have some hereditary conditions in their family history. They would like to meet with a genetic counselor for pre-family planning to determine the level of risk for their children. After you make your appointment, you can start to prepare. Think about questions you have for your genetic counselor. Outline your family's history of health conditions. Note any questions you have about inherited risks. Think about any of your lifestyle factors that might impact your health. At your appointment, you will review your questions, family history, and inherited risks. Your genetic counselor can help you and your physician determine whether any genetic tests may provide additional information, identify the best testing options for you, and will help you understand what those test results may or may not tell you. You will also review how the results may be used along with healthcare and support options based on possible results. If you do move forward with genetic testing, your genetic counselor can help you understand what to expect. Many genetic tests are done through a simple blood sample. Once your test results are ready, your genetic counselor will help you interpret the results and what they mean for you and your family. They may discuss follow-up tests that could be ordered based on your results, or you may need to schedule follow-up appointments with your genetic counselor. You may talk about any medical or lifestyle options or family planning. To learn more about how genetic counseling could benefit you and your family, visit findageneticcounselor.com.
So that video went over some brief information about referrals to genetics, what might happen at a genetic a referral appointment, and what could happen afterwards as well. So the video talked about different scenarios where one might seek out a genetics referral. A prenatal preconception referral is generally for individuals and couples who are thinking about having a child or may already be pregnant to assess the baby's risk of having a genetic condition. A pediatric referral generally involves working with children and their families. Usually these children have a known or suspected genetic condition, a birth defect, an abnormal newborn screening result, or a physical or developmental delay. Oncology or cancer referrals can involve individuals or the entire families. And this is where we might take a closer look at your family health history to talk about risks for inherited cancer, as well as screening and management for those at increased risk. Once you're at the appointment, the provider will evaluate you, your child, and or your family to discuss their findings and whether any additional testing or screening may be recommended and what those next steps would look like. Genetics is also one of a variety of specialists that someone could be referred to. You could also, following a genetics referral, be referred to additional specialists for some additional evaluations. And sometimes visiting one specialist could lead to multiple referrals as well, because sometimes it's like putting together a puzzle where we might need some advice or expertise from multiple different healthcare providers in order to put all these pieces together to figure out what is going on in an individual or their entire family. But if you think you need a referral to genetics, make sure to talk to your primary care provider and or pediatrician to see what the best next step would look like, or reach out to your nearby genetics clinic to see what their process looks like. You can find a genetics clinic through the American College of Medical Genetics, or find a genetic counselor through the National Society of Genetic Counselors. And Medline Plus has some extra information for you about insurance coverage and reimbursement as well. But thank you so much for listening. If you have any questions, please feel free to reach out to the National Family Center, and we appreciate you taking this time.